Okay, good evening everyone. So recently I was reading about blood components and blood transfusion. So I have noted down certain points which I was reading, and these are important points at least for me. So I thought of sharing with you all, and I think that everybody who is working in the intensive care or emergency medicine should know at least these points, so that issuing the blood form or generating the request for the blood form is a little bit will be easier for them, and they can understand the things better. So what I have done is I have noted down in my notebook. So it's a casual video, just interacting with you all. If you feel I have missed everything, something, you can always ask in the comment section. So else making a ppt and all other stuff would have taken time. So I'll be reading from the notebook, describing from the notebook. So I may not look you directly in front, but just bear with me. I hope this video will be useful. So basically this morning somebody asked me why we do not transfuse the whole blood to a patient. So the whole blood transfusion practice was started around World War, where rapid transfusion of blood components, procuring them was a little bit difficult, so the whole blood being transfused. And today also some people feel that transfusing whole blood will provide packed red blood cells, plasma, means fresh frozen plasma, and platelets simultaneously to the patient. But it is not true, because the storage temperatures of these components, whether it's platelets, FFP, and red blood cell components, is different, and especially platelet loses efficacy in whole blood. So transfusion of whole blood is not encouraged these days, though research is coming, and again interest in the whole blood transfusion is being generated recently. But as of now, every blood bank tries to separate the components into three red blood cells, fresh frozen plasma, and platelets, and issue them separately. So what we'll do, we'll discuss very important points regarding these three cells. So the first one is packed red blood cells. So whenever you have a patient in the ICU, so the threshold for transfusion is, if it is non-bleeding, or it's not a cardiac patient, or a patient is not a very old patient like more than 85 years old, 7 gram hemoglobin is the threshold. But and in previous three conditions, means if a patient is bleeding, keeping the blood hemoglobin above 9 is recommended. Now this packed red blood cells, suppose, imagine in a scenario you need to issue a form. So you need to understand that the red blood cells in the blood bank are stored somewhere between 2 to 6 degrees. They are stored in 2 to 6 degrees, and the shelf life depends upon which type of anticoagulation, which type of preservative used in that blood bank. So there are two most commonly used. One is CPDA1. One is just a generation, and C stands for citrate, which provides the anticoagulation in that bag. Phosphate acts as a buffer. Dextrose provide energy to the red blood cells, and adenine is an ATP generator. So CPDA1, the shelf life of this PRBC component is 35 days. The most common which nowadays used in the blood bank is SAGM, SAGM. So S stand for saline, so suspension, and adenine, A is the adenine, G is for again for glucose, and mannitol. There is no citrate in it. The mannitol acts as a red cell membrane stabilizer. So the preservative, if SAGM is used, the shelf life increases to 42 days of that red blood component. Now one PRBC bag contains somewhere around 220 to 280 ml of blood in that, and it is stored at 2 to 6 degrees centigrade. Shelf life I have told you. And how much time it takes for someone to issue it. So you need to send a cross match sample. You need to send a crossword sample to the blood bank. And what blood bank do that there, blood bank cross matches that sample with the PRBC bag sample. Earlier this cross matching takes somewhere around 45 minutes at least to cross match the sample. Now newer techniques have come up in which in between 20 to 25 minutes they can cross match. So even if you have so for as a generalized rule, if you request the blood bank immediately with a cross match sample, then the blood bank will require at least 30 to 45 minutes between duration to issue a blood bag, so PRBC bag. So 45 minutes, 30 to 45 minutes, the minimum interval in any emergency the blood bank will require at least to process the thing. You definitely need a cross match sample. Now there at times there is one more in good blood banks there is also one facility is leukodepleted packed red blood cells. What this leukodepleted means, they filter out the white blood cell from this bag. So because most of the allergic reactions occur due to this white blood cell component, and when in leukodepleted cells the chances of allergic reaction goes drastically down. So if a patient has allergy to during first blood transfusion, you can request for leukodepleted packed red blood cells. More and more blood banks are coming up with by default issuing leukodepleted packed red blood cells. Okay. Now this one more good thing is this packed red blood cells from issuing from the blank. If you have ordered 3-4 units and suppose the patient requires 2 at this time, and now one or two components you need not to transfuse right now, this can be stored in a local unit or ICU in a blood storage component where there is a separate box for that, or separate storage fridge sort of there, in which 2 to 4 degrees centigrade, 2 to 6 degrees centigrade is maintained, and you can store that blood component in that, and whenever the patient requires you can transfuse. But try to get the blood only that much issued which the patient require. So this is something. Now when the blood has reached you, means after issuing from the blood bank, when the PRBC has been reached to you, you need to transfuse it within 4 hours. So once it started, the transfusion should ideally be finished in the 4 hours. At times, if the patient is an LVF or some having fluid overload or because of any other indications, at times it is extended to 5-6 hours, but ideally it should be transfused within 4 hours once it started. Secondly, don't actively warm the blood because it can cause hemolysis to the RBCs. It should be warm to the room temperature in a passive manner, and once you keep it within 15 minutes, it comes to the room temperature. So do not active warm, let it warm normally, and within 15 minutes it will come to your normal temperature, and you can then transfuse. Now one important thing is, if the patient is bleeding or a trauma patient, if you want to put a pressure bag above the RBC bag so that it get transfused very fast, then you need to at least put a 18 needle 18 number intracath, 18 gauge or 16 gauge, because below 18 means green one. If you put give pressure in the RBC bag and you have a 20 gauge needle in the patients, the cells can get hemolyzed. That's the issue. If it is a regular transfusion, then you can give, but for a pressurized transfusion, 16 to at least minimum 16 gauge needle should be there. Ideally minimum 18 gauge needle should be there. For normal transfusion, 22 is fine, but for pressurized, minimum 18, that green one should be there. 16 would have been helpful. And the transfusion set in every transfusion component, it should be changed after every transfusion, ideally, and we do that. Now the second is fresh frozen plasma. As why the name suggests, you know that fresh frozen plasma is frozen, means it is stored at minus 40 degrees centigrade. So suppose you have ordered a blood bank, so because the plasma is stored at minus 40 degrees centigrade, they will thaw it means they will bring it to the normal temperature and then will issue it. This also takes time, so this also takes somewhere around 20 to 30 minutes, so they cannot issue it earlier than that. So once thawed, they cannot be put back to the to your blood bank again. So this is very important. In PRBC, we could have stored in our local unit if we are not transfusing under 2 to 6 degrees centigrade, but maintaining minus 40 degree, once the plasma has been thawed, it cannot be done. So make sure you are requesting only for the required amount. So they are stored at minus 40 degrees centigrade, and the shelf life is 1 year. The shelf life is 1 year. That is very okay, good. But they should be transfused as soon as possible they reach to you. This is important. Dose is usually 10 to 15 ml per kg body weight of the recipient. This is one thing you need to understand. Okay. Now platelets. Platelets are stored somewhere around 22 to 24 degree centigrade, and one bag contains 50 to 70 ml of platelets, and the shelf life is only 5 days. These are, I am talking of random donor platelets. There is also single donor platelets. The single donor platelets contains 200 to 300 ml of platelets, and it also stored around 20 to 24 degrees centigrade. Shelf life is 5 days. But this random donor platelets, one component contains 50 billion platelets per bag, and this SDP contains 300 billion per bag. So obviously it is very single donor platelet is effective, but single donor platelet takes time. It takes time for the collection from that patient, and it takes around 2 to 3 years. While the platelets which are stored at 22 to 24 degrees centigrade can be issued immediately in 5 to 10 minutes. They just need the blood grouping in that. So one more important thing is, only for blood transfusion, means PRBC, they need to cross match. For FFP and platelets, they require sample, but they usually don't cross match. Only the blood group is required. But because in FFP they were requiring the plasma to come to the normal temperature, they need to thaw it from minus 40 to normal temperature. It was taking time. But in platelet, they just need the group, and they can issue it immediately within 5 to 10 minutes. That's the thing. Platelet also should be required, should be transferred as soon as possible. I'll show you one or two pics to understand why platelet and FFP should be transfused as soon as possible, because if you do not transfuse, they will get destroyed. I'll show you, because platelets are stored in a agitating manner, means in a moving manner. They keep moving like this so that the platelet doesn't get coagulated. They don't get clumped actually. Coagulation is not the term. They doesn't get clumped and get destroyed. So that's about platelet. One more thing, there is a confusion. Some have asked me whether in a O positive or A positive or B positive person can we give blood platelet of different blood group. This is a tricky one. Ideally, if in ideal case scenario, because platelets, there are no PRBC blood component in the platelet, so there is no antigenic activity. So in O positive, A positive, B positive blood group, patient can also transfuse another blood group platelet, but it depends upon how the platelets are being collected. So ideally, you should match the blood group of platelets, and your blood bank specialist, blood bank person can tell you. But if in emergency, you can give one positive blood group platelet to another positive blood group patients, but you cannot transfuse between negative and positive. Means O negative, A negative, AB negative, A negative will require a negative blood group platelet only, and A positive, B positive, O positive, and AB positive will require positive blood group platelet only in emergency. So don't mix that. But in dying emergency, we can transfuse platelet of an O positive, A positive, B positive, or AB positive interchangeably. But this applies only to the platelet. Again, before confirming this, always confirm with the blood bank how they have collected. At times, the collection techniques differs. In that, if some blood antigenic component is there, so only that group platelet should be transfused. So read this more about it, and be careful in this. So as of now, blood group should be matched properly, and it should be cross matched with them. So for PRBC, they are requiring cross matching blood. That's why it's taking time. Once it reaches to, you should warm and transfuse within 4 hours. FFP, because from minus 40 degree to coming to normal temperature, it is taking time. That's why it's taking time. They are not cross matching it, but they require the blood group. They need to match the blood group at least. For platelet, they can issue random platelet immediately. For single donor platelet, they will require time. Anything more? I think I have covered most of the stuff which I require, which है. हाँ, platelet and plasma should, FFP should be transfused ideally within 30 minutes. They should both, all the FFP and a platelet should be transfused within 30 minutes once you have started them. And okay, so now I'll show you something how they are stored, so you will see a visual glimpse of how it is done. Okay, so this is, you see, unscreened packed red blood cells. They are stored between 4 to 6 degrees centigrade, A positive, B positive, negative. Also, it is a screen one, 4 to 6 degrees centigrade they have stored. This is fresh frozen plasma. You can see they are frozen. They are rock solid, hard plasma. Now, important is when it comes to from minus 40 to normal temperature, at times this bag ruptures, or if there is a air bubble, it breaks. So if you have asked for 4 plasma and we are thawing, suppose the air leaks and it bursts the bag, they need to again do the process. That's why if you have asked for 4 plasma, they are able to give only 3 in that particular period of time, and they will require more time to issue the next one. So this is stored as FFP are stored as minus 40 degrees centigrade. These are platelets. You can see. Now the important thing I want to show you, the platelets are stored in this fashion. You can see how they are moving. Again, I'll show you how they are moving. They are stored in this moving manner. That's why platelets should be transferred as early as possible. Otherwise, they will get clumped. So that was something in short about these blood components. If you have any doubt, you can ask in the comment, or obviously on our icu.in/forums. I will love to answer those queries. So I was reading, so I thought of sharing this with you all. Thank you.